Welcome to our deep dive on intraoperative ultrasound, or IOUS in brain surgery. You've sent over some really interesting material on this topic, so I'm excited to dig in and see what we can uncover.
Well, IOUS is becoming an increasingly valuable tool in veterinary neurosurgery. It essentially allows us to see inside the brain in real time during surgery using sound waves.
So it's like having an extra set of eyes,
Hmm.
but these eyes can see through tissue.
Precisely. It provides a level of detail and guidance that we simply didn't have before.
Okay, let's unpack this. Why is IOUS such a game changer for surgeons operating on such a complex organ like the brain?
Well, one of the biggest challenges in brain surgery is dealing with brain shift. That's when the brain moves slightly during the procedure, which can make it difficult to accurately target the surgical site. IOUS helps us to monitor these shifts in real time and adjust our approach accordingly.
That makes a lot of sense. It's like having a GPS for the brain, guiding the surgeon every step of the way.
Exactly. Another major advantage of IOUS is its ability to visualize blood flow using Doppler mode. This is critical for identifying and avoiding damage to important blood vessels in and around the tumor.
So it's not just about seeing the tumor, but also about understanding the surrounding vascular structures.
That's right. This level of precision is essential for minimizing the risk of complications and ensuring the best possible outcome for the patient.
It sounds like IOUS is really all about maximizing effectiveness while also minimizing risk. Are there any other key benefits that we should know about?
Absolutely. IOUS is also extremely helpful in defining the borders of the tumor. This allows surgeons to remove as much of the tumor as possible while preserving healthy brain tissue.
That's crucial, especially when dealing with tumors that can be difficult to distinguish from surrounding structures.
And once the tumor has been removed, IOUS can be used to confirm that the resection is complete. This is particularly important for aggressive tumors that have a tendency to recur.
So it's like a final check to ensure that the surgeon got everything.
Exactly. It adds an extra layer of confidence and helps to improve long-term outcomes.
Okay, so we've covered a lot of ground on the advantages of IOUS. But surely there must be some downsides, right?
Of course, no technology is perfect. One of the main limitations of IOUS is the cost of the equipment. Specialized ultrasound machines are required, which can be a significant investment for veterinary practices.
That's understandable. New technology often comes with a hefty price tag.
Another challenge is the learning curve associated with IOUS. Surgeons need specific training to use the technology effectively and to interpret the images correctly.
So it's not just about having the machine, it's about having the expertise to use it properly.
That's the crux of the matter, and like any surgical skill, experience plays a big role in mastering IOUS.
Okay, so now that we understand the why behind IOUS, I'm curious about the how. Can you walk us through the process of actually performing IOUS during brain surgery?
Certainly. Imagine we're in the operating room and a brain surgery is underway.
Got it. Take us through it step by step.
First, we need access to the brain. This can be achieved through existing skull openings or by creating a new one during the surgery.
And I assume sterility is paramount in this kind of procedure.
Absolutely. Maintaining a sterile surgical field is crucial. The ultrasound probe is covered with a sterile sleeve and gel to prevent any contamination.
Okay, so the probe is in place. What happens next?
The surgeon uses specific movements to visualize the surgical area. Think of it like scanning a barcode, but in much more detail.
Interesting. And how do they make sense of what they're seeing on the screen? Is it like looking at a map in an unfamiliar city?
Pre-surgical MRI or CT scans act as our roadmap. They provide a reference point for the surgeon to orient themselves within the brain.
So they're constantly comparing the live ultrasound images with the pre-op scans.
Precisely. And remember the Doppler mode we talked about? It's particularly valuable here as it allows us to identify blood vessels before making any incisions.
That seems incredibly important, especially when working in such a delicate area like the brain.
It is. However, there's another factor to consider. Things can shift during surgery, so the surgeon may need to reorient themselves periodically using those pre-op scans.
So it's not a static process. It requires constant vigilance and adjustment.
Exactly. And the uses of IOUS extend beyond just visualizing the tumor. It can also guide biopsies, assist with instrument placement, and even pinpoint the source of any bleeding.
Wow. It really is a versatile tool. It's like having a whole toolbox in one device.
Indeed. And speaking of tools, probe selection is also an important consideration in IOUS.
What are the different types of probes, and how do surgeons decide which one to use?
There are two main types, linear and microconvex probes. Both use sound waves, but the shape of the microconvex probe often fits better within the surgical opening.
So the shape of the probe is important for getting the best possible image.
Yes. And the frequency of the sound waves also plays a role. For most dogs and cats, a frequency between 7.5 and 12 megahertz provides good image quality.
It's fascinating how all these technical details come together to create such a powerful tool. Now, I'm really eager to hear about those real-life case studies you mentioned. Can we dive into those now?
Absolutely. Let's start with our feline friend, an 8-year-old spayed female domestic longhair who presented with a 6-month history of seizures.
Okay, what did the initial diagnostics reveal?
Imaging showed a significant midline dorsal mass. It was multilobular, T1 and T2 ISO to hyperintense, and heterogeneously contrast-enhancing.
Sounds complex. How did IOUS assist during the surgery?
IOUS was essential in delineating the full extent of the tumor, especially given the considerable brain shift during the procedure.
So it helped to ensure a complete resection despite the surgical challenges.
Precisely. It also facilitated the identification of any residual tumor portions, which is vital for long-term management.
That's really impressive. Can we move on to the next case?
Of course. Our second case involves an 11-year-old male neutered Boston Terrier, also presenting with a history of seizures.
What were the findings in this case?
MRI revealed a large intraaxial T1 isointense and T2 hyperintense fluid-filled mass in the right piriform lobe.
How did IOUS contribute during the surgery?
IOUS enabled precise visualization of the mass, guiding both the biopsy and subsequent total gross resection using a Cavitron ultrasonic surgical aspirator.
So it played a key role in both diagnosis and treatment.
That's the burning question, and the answer is yes. The histopathology, guided by the IOUS-assisted biopsy, revealed a high-grade astrocytoma.
Wow. It's amazing how IOUS can provide so much valuable information in real time.
It truly is a game changer. And we have 2 more fascinating cases to discuss, which further highlight the versatility and effectiveness of IOUS in various surgical scenarios.
Well, I'm on the edge of my seat. Let's hear about those other cases, and then maybe we can chat about what the future holds for IOUS and veterinary neurosurgery.
Sounds good to me. Let's jump right in. Our next patient is a 10-year-old neutered male boxer, also presenting with seizures.
Okay. And what did the MRI show in this case?
Similar to the Boston Terrier, imaging revealed a large intraaxial T1 isointense and T2 hyperintense fluid-filled mass, this time in the right parietal lobe.
Interesting. So how did the surgical team utilize IOUS during the right rostrotentorial craniectomy?
IOUS was, again, instrumental in visualizing the mass and guiding the biopsy, much like in the previous case.
Were there any notable findings or differences in this Walker's case?
One remarkable aspect of this case was the precision of IOUS. The measurements taken using IOUS matched perfectly with the pre-surgical MRI measurements, further emphasizing the technology's accuracy and reliability.
That's incredible. It really highlights how IOUS can provide real-time confirmation of what we're seeing on preoperative imaging.
Precisely. Now, for our final case, we have a 9-year-old female spayed Schnauzer with a 2-year history of increasingly frequent and severe seizures.
Okay. What did the MRI reveal in this Schnauzer?
The MRI showed a contrast-enhancing mass in the left frontal lobe adjacent to the falx cerebri.
And how did IOUS factor into the surgical approach in this case?
IOUS played a key role in both the biopsy and subsequent removal of the tumor, guiding the surgeon throughout the procedure.
So it facilitated both diagnosis and treatment in this case.
That's the crux of the matter. It allowed for precise targeting of the mass and minimized damage to the surrounding brain tissue.
It's fascinating to see the variety of ways IOUS is being used in these cases. It seems like it's truly transforming the way we approach brain surgery in animals.
It absolutely is. Its real-time guidance, precision, and versatility are revolutionizing veterinary neurosurgery.
Okay, so we've seen how impactful IOUS can be in these real-world cases. Now, I'm curious about what the future holds for this technology. You mentioned earlier that there are some exciting advancements on the horizon. Can you tell us more about those?
Of course. There are several promising developments in human medicine that could eventually be applied to veterinary patients. One area of research is contrast ultrasound.
Contrast ultrasound, what exactly is that?
It involves injecting special dyes that enhance the ultrasound image, making it easier to differentiate between tumors and healthy tissue.
So it's like adding another layer of detail to the ultrasound picture.
Precisely. This could significantly improve the accuracy of tumor identification and resection.
That's incredible. What other advancements are researchers looking into?
Another exciting area is elastography.
Elastography. I'm not familiar with that term.
Elastography measures tissue stiffness. Tumors often have a different stiffness compared to normal brain tissue.
So it's like using touch to determine the difference between different types of tissue.
That's a good analogy. This information could be extremely valuable for surgical planning and decision-making.
I see. Are there any other developments that you're particularly excited about?
Yes, researchers are also exploring fusion imaging.
Fusion imaging, what does that entail?
Fusion imaging combines IOUS with other imaging modalities like MRI, CT, or even PET scans.
So it creates a multidimensional view of the brain.
Exactly. It provides surgeons with a more complete picture, allowing for even greater precision in their actions.
Wow. These advancements sound truly groundbreaking. It seems like the future of brain surgery is very bright.
It certainly is. These advancements have the potential to significantly improve the lives of animals suffering from neurological conditions.
It's inspiring to think about the possibilities. Now, as we wrap up our deep dive on IOUS, I'd like to leave our listeners with a thought-provoking question. Considering the rapid pace of technological advancement, how do you envision IOUS evolving in the next decade?
That's an excellent question. It's difficult to predict the future with certainty, but I believe IOUS will continue to play an increasingly central role in veterinary neurosurgery.
In what ways? What specific changes do you foresee?
I think we can expect to see even more precise tumor removal facilitated by advancements like contrast ultrasound and elastography. We may also see less invasive procedures leading to shorter recovery times and fewer complications for our patients.
It's amazing to think that we might even be able to treat conditions that are currently considered inoperable.
Absolutely. The possibilities are truly endless.
This deep dive into IOUS has been incredibly enlightening. It's clear that this technology is revolutionizing the way we approach brain surgery in animals.
I completely agree. It's a testament to the ingenuity of researchers and the dedication of veterinary surgeons who are constantly striving to improve the lives of our animal companions.
Now, before we conclude our discussion on IOUS, I'd like to touch on one final point. What stands out to you about the potential of IOUS, not just in terms of the technology itself, but its broader impact on the field of veterinary neurology?
Well, what's fascinating here is that IOUS isn't just a standalone tool, it's a catalyst for broader advancements. Think about it. More precise imaging leads to more accurate diagnoses, which then paves the way for better surgical planning, more effective treatments, and ultimately improved patient outcomes. It's a chain reaction of progress driven by this one technology.
That's a great point. It's not just about the immediate benefits of IOUS during surgery, it's about how it elevates the entire field of veterinary neurology. It's like raising the bar for what's possible.
Exactly, and that's why it's so crucial for veterinary professionals to stay informed about these advancements. The more we understand about IOUS and its potential, the better equipped we'll be to advocate for its adoption, invest in the necessary training, and ultimately provide the best possible care for our patients.
Absolutely. Knowledge is power, especially when it comes to animal health. So to our listeners out there who are just as fascinated by IOUS as we are, we encourage you to delve deeper, ask questions, and explore the resources available. The world of veterinary neurology is constantly evolving, and it's an exciting journey to be a part of.
Couldn't agree more. And remember, even though we've covered a lot of ground today, this is just the tip of the iceberg when it comes to IOUS. There's so much more to learn, explore, and discover.
Well said. This has been a truly deep dive, and we hope you've surfaced with a newfound appreciation for the incredible potential of IOUS in veterinary neurosurgery.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.